This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. On this episode, I'm joined by Dr. Motin. Welcome.
Oh, hi, thanks for having me here.
Thank you for joining us today. And the goal of today's episode is for us to hear a little bit about you and your journey into medicine and treating behavioral health. And also what's new and exciting and new innovations that are coming forward with our behavioral health unit in St. Joe. So first, let's start with you.
Yeah, so first of all, thanks for having me here. It's really, truly an honor. Well, my journey started when I was quite young. Medicine is something I always wanted to do. It's something I aspired to do. I always enjoyed the science background, but really the mental health journey was more of a personal thing for me. I actually had a family member who was suffering from mental, illnesses, behavioral health issues. And unfortunately, they were not educated in how to get the right help. What were the signs and the symptoms to look for? And a lot of the diagnoses got missed. Unfortunately, they, succumbed to that mental illness. And I felt it was, someone needs to stand up and, really educate the communities and educate people about what mental health and behavioral health looks like in order for people to get that right help. Yeah.
Well, and that's what started you on your journey. And a lot of people, you choose things that become very personal to you and that you feel personally connected with. And we're very fortunate to have you here in our community and helping support us. And you've lived in Michigan for a long time.
A very long time, yes.
Yeah. So you're used to the beautiful summers and the cold winters.
And the winters, yes. Especially this past winter, the commutes were very, very interesting.
Yeah. Well, thank you for helping us. And you talked about this journey that you've been on and how this type of medicine is very personal to you. And I think back on some of my experience as a nurse and helping to provide care to patients in a behavioral health unit and the sterility and the regulations and how cold that can be. But then I also now, in my career focus today is how do we provide care to a community when we know this is one of the number one services that we need access to care, not just in Michigan, but at a national level. And part of those challenges have been not being able to recruit people or physicians and APPs to be able to help support the needs. But also, do you think there's any correlation around people not feeling comfortable with addressing those concerns?
As humans, we like consistency, right? We want to know what's going on. We want to be able to have that control over, what to expect and whatnot. And so with mental health, I mean, when that is when your mental health or behavioral health is in crisis, that control is kind of lost. And so people are often scared. It's easier to say, I can treat a chest pain because there's lab work that we can do versus, there's not blood work that we can do for someone who's having depression or suicidal thoughts, right? So the key, and also I mentioned my family member where a lot of the symptoms and the diagnoses was missed. A lot of people are not educated. So making sure we help people understand what are the signs to look for, what are the symptoms to look for in order to be able to come in and get that help. I know that our team is very dedicated in working with all of our medical teams, whether they're in the emergency room, the internal medicine team, the surgical teams. They have been very gracious about asking us like, hey, what are your opinions and how can we, educate our patients on what to look for? So we're trying to educate our doctors, our APPs on, in outside of the psychiatry field so that our patients don't get missed.
Yeah.
Yeah.
And you mentioned on just patients feeling scared at times to take that step. What type of advice would you give the community if they're feeling that tension or fear and to express how they're feeling or what they're going through?
It's normal to feel scared. I mean, if you're not scared, it's a very normal human reaction to feel scared, to be anxious, to not know what's going to happen. How will people look at me? How will people see me? That stigma of having a mental health or a behavioral health issue. Our ERs are pretty well staffed and well educated on like, hey, what are the signs that they can look for, right? Knowing that, hey, they're in good hands. We are right here in the Corewell Hospital as well, where we can come in and do consultations and be able to help our patients as well. But again, you don't have to do it alone.
Yeah.
The one big thing, it's like, yes, the fear is there, but know that, hey, when you do come in and seeking that help, you're not alone. You're not going to be by yourself. We're here to give you that hope that you can anchor on, so that you continue to move in that process of like, hey, are you someone who needs therapy? Do you need medication? Do you need to go into like a behavioral health unit and get some reprieve there? So just know that we are here for you, and we're not going to let you go through this by yourself.
Well, I think it's really reassuring how you are working as a team with medical professionals across Southwest Michigan to be able to provide the right access to care for the community. So thank you. One other area, I know you've been a huge supporter on this, is redesigning the environment of our behavioral health unit in St. Joe. Can you give the community kind of a sneak peek of what that's going to look and feel like?
Yeah. So right now, I mean, if you walk in, you kind of imagine it's
It feels like the environment I worked in, sterile, cold.
Yes, very much so. And so when I got to review some of the floor plans of the new unit, I mean, I was excited. I was blown away. You can tell the architects, even like yourself and our unit manager, who has taken a lot of care and thought about like, hey, when we build this new unit out, how will our patients feel? And the goal is, there's going to be a lot of color and painting, and paintings on the walls. There's going to be a lot of sunlight and just that warm, safe environment that we want to create for our patients, to know that, hey, when I come into this unit, I know I can rest. I can actually let my body rest and heal from what I'm going through right now.
Yeah. Well, we really appreciate your expertise and leaning in on this project. There's a lot more research today and studies that help guide us in these types of decisions on things we didn't think about 30 years ago when we were building buildings and units, but we're thinking about today because environment matters. And environment is a direct correlation to healing and outcomes, in addition to wonderful physicians like yourself leading the charge of practice. But I think we've come a long way in healthcare to understand that we have to think in multiple dimensions for our patients to heal and be healthier in our community.
Absolutely.
Yeah. Is there anything else that you think the community would like to know, or anything you want to share?
I mean, we're here. We have a dedicated team of doctors and APPs and social workers who are, nursing staff who are here to help our patients. We're here to listen to you. We're here to help guide you through this, unknown, scary process for a lot of people. And if there's one thing that we want to give our community out there is that, is hope. It can feel very dark and heavy when you're doing it by yourself, but we are here, and we are here. We're open to holding your hand through the entire process.
Well, thank you. That compassion and empathy goes a really long way. And I appreciate you as the medical director leading that charge, because creating that sort of culture does eliminate the fear and does make our access to care feel more tangible and relatable. So thank you.
Thank you.
Thank you for joining me on this episode of Core Conversations. We'll see you next week.